Hello, Dr. Damian Martinez here, talking today about what causes spinal pain. There are many theories and ideas out there as to what causes pain. My 21 years experience has showed me that most back pain has a multitude of sources. I'm going to give you 5 examples of where back pain can originate from and contributing factors to that. But I will tell you this from the onstart, that chiropractic adjustments help reduce pain because we treat the cause of the problem, and even more important, preventing flare-ups from occurring in the first place, because inflammation, especially chronic inflammation of your spine, leads to degeneration, which leads to more inflammation, which leads to more degeneration, which leads to more inflammation, which leads to more degeneration, and it's a snowball effect. It continues to get worse as it gets worse, and to the point where it's very debilitating, and you'll find yourself having a very difficult time doing tasks and things that were once very easy for you to accomplish. So just going right into it, most spinal pain that I see has a number of origins. One of it is in the muscle tissue. You'll have muscles, spindles that are inflamed, that are contracted. When muscle spindles are contracted, it restricts the fluid dynamics of blood getting into muscles and waste getting out of the muscles. So you're going to have less oxygen getting into contracted muscles, and less histamines and bradykinins and pain-causing chemicals that your body makes from getting out of the muscle tissue. This is also going to affect your tendons and cause swelling and inflammation of the tendons that attach to the bones as well. In addition to that, you can have inflammation of your discs. Actually, degenerated discs have been known to grow new sensory nerve fibers into the disc, which will create a discogenic pain, or pain that originates from discs. Now, these discs many times are degenerated or dehydrated due to traumas that you've had in the past, due to repetitive strains from your job perhaps, or sports injuries, or having a subluxation, a misalignment, or a locked area of the spine, constantly creating load on that disc. And this is where chiropractic is very helpful in decompressing and allowing those discs to rehydrate themselves properly and preventing this problem from happening in the first place. Another origin of the pain could actually be in the joints or the articulations of the spine, where the articulations, where the capsules that surround those articulations actually expand, and the receptors that are on those capsules will send a signal to the brain. Once again, chiropractic adjustments are a wonderful way in keeping this capsule swelling down, especially if you're waking up in the morning and you're very sore and very stiff and it takes you an hour or two to get going. This is an indication that you're having capsule inflammation or swelling of the articulations of the spine. Once again, chiropractic is a wonderful method in reducing this swelling because it treats the cause of the problem. In addition to that, you can have nerve encroachment or spinal cord encroachment, where the canals of the spine are narrowed. You have a real estate problem. There's not enough space for the nerves to exist. There's intrusion onto the environment of nerve tissue. This is another source of discomfort and pain, where your pain many times will radiate into your arms or into your hands or into your legs even. And once again, as a chiropractor, we're able to adjust the spine to help reduce swelling and inflammation and create more real estate, more space for those nerve roots so that they can function properly. So you see, there's many origins of pains. It can come from the muscles and the tendons and the ligaments. It could come from the discs. It could come from the joint capsules. It can come from nerve root compression and irritation of the nerve roots or the spinal cord itself. As a chiropractor, we're able to address all of those issues by keeping your spine balanced, whether you're a 1-day-old or whether you're 100+ years old. Keeping your spine unsubluxated is the key element, along with proper nutritional advice, is the key element in reducing the cause of these problems.